So it's my extreme joy to share with you my passion and one of my favorite Greek words, enthusiasm, which means to bring God inside, about light and color therapies. And we'll talk about the light and color therapy pioneers in the next 50 minutes. I'll go real fast. This is going to be a very right hemisphere presentation. We're going to be quick and dirty, sort of like flying in an airplane over 30,000 feet over the territory. We're going to look at the past, the present, the people here, and the future of what I think color and light therapy are going to be about. So, all right, with that said, let's go. I'm just very excited to be here with such an extraordinary group of people. When you think of the quantity of experience, educationally, clinically, that's here, this is another groundbreaking opportunity to really learn from, in my mind, the best in the field. So this has been and will continue to be an awesome week together. This is just a quick roadmap of where we're going in my presentation in the next 15 minutes. I give you the introduction. The conclusion is essentially that light creates miracles. Everybody in this room knows. And this week ahead, you'll hear about miraculous transformations, if you will, healings that aren't supposed to be possible in education or medicine, psychology, using light, and whether you use light through the eyes or on large segments of the body or on small segments like acupoints or chakras, light indeed transforms lives, the structure and function. Tremendous transformational healing occurs with light. We'll take a quick look at the paradigmatic lenses of how light has been looked, sort of historical lens, looking at light from a biochemical standpoint or a biophysics standpoint, and finally subtle energetic standpoint. Alexander did such a phenomenal job last couple of presentations. So we'll just skim across, maybe highlight some of the highlights of heliotherapy, sunlight therapy, that's been around for 2,500 years or more, and look at some of the artificial light devices. Take a look at what the pioneers were using 125 years ago. So we'll look more at colored light practitioners and the use of light in medicine, use of light in optometry, acupuncture, architecture and the environment. We have some pioneers in the use of light in the environment, in architecture. And also the use of light in education, which is a real sweet spot for me. I first started out in 1986 with a local optometrist named John Downing, who told me that everything I was doing with brainwave biofeedback, I could be doing even better with colored light through the eyes when I worked with kids with attention deficit disorder and reading problems. And this week we'll have phenomenal presentations on the use of light in education, the use of light in dyslexia in particular. And finally, if the time permits, my passion is using light in consciousness expansion, light to help people move through their psychological traumas that are often held in the ocular system, in the eyes and brain. The eyes and brain are the first places people shut down when they're exposed to trauma. And then finally, we'll look back to the future of light and why this organization, the International Light Association, is so vitally important to the future of light. Just a quick thank you to Phyllis and Randy for this extraordinary time. You worked so hard, tirelessly. And a thank you to the ILA board, Alexander Wunsch, who's given to us incredibly, saved the organization 2.5 years ago. Our wonderful Vice President, Larry Wallace, who is not only a foundational cornerstone of this organization, but for syntonics, and opened up syntonics after Jacob's steps to beyond optometrists to greater openness of discussion about light and color with the widest variety of health professionals. Then Don Berniski, who's our light on our board as well, will talk to us on light and dyslexia. And I finally want to thank my wife Jennifer for all her support in communicating and reaching out to people around the world. And Lisbeth Hoibricks, our secretary, Carl, who is in the planning stages of our next year's symposium, which may be in Vienna. And finally, our treasurer, Randy Marie. So for me, ILA has been like a rainbow family. I don't know if you guys have seen this. This is called the universal flag. And it's a symbol created through universal consciousness in order to expand awareness. The colors are vibration of energy common to all. The waves represent the ups and downs of daily life. The gold band represents the golden rule, our highest teaching. So treat one another as you want to be treated. The white represents the purity from which we come. By displaying this symbol, we represent the truth of who we are. We are one with all. We are divine presence. We are truth. We are eternal. We are interdependent on all. So I was touched by this. And for me, ILA is indeed a global family. And what unites this very diverse group of people who are here at the International Light Association. So there's an outstanding number of years, as I've said, of accumulated experiences working with light and color. And for me, this is the rarest opportunity to learn from the master teachers and the master practitioners of light and color therapy. And I believe it's our collective love of the transformational healing potential of light that draws us together and sustains such a diverse group from around the planet. So this was the 6th year of our fledgling organization, and we've honored very special individuals who over the years have given tremendously of themselves. This is a beautiful crystal obelisk, and on the right-hand side is a globe made of crystal as well. So we've awarded Alexander Wunsch, who has really pioneered our wonderful website that we had to be an information nexus to the world. Alexander has been the face of the International Light Association at such incredible places like Psy.D. He's appeared on television and radio in German-speaking countries, and we're just very grateful to Alexander's leadership through the years. Lisbeth Hoybrecht has been our secretary, and Lisbeth and Randy, I don't know if you know that we've given you awards, and we couldn't carry them in our suitcase. But for Randy Marie Eide and Lisbeth Hoybrecht, in appreciation for your dedication and service. These women have put out so much to keep the economy and keep the communication and the structure of our organization. Wim Boykin in the bottom left was our first founding president. Next to him, Francis McManaman, psychologist from Dallas, Texas, was our first elected president. And Marco Bischoff, who gave so much for the educational committee, actually doing the groundwork for a university education in light therapy. So we've honored all these people. So when we talk about light, on the left, we have the emission spectrum that Alexander put up. And light, for me, leads to healing and transformation at the speed of light. This is the upper right hand is my buddy Stephen Vasquez, a psychologist. And when Stephen and I were floundering about what these various colors might do psychologically, there was no roadmap. Whereas Jacob Lieberman's artistry and profound transformation that I saw, I remember in 1988, see Jacob work with an individual with colored light. And what he was able to do with colored light and talk therapy, I knew it would take me 6 months without light to get where he got in just merely 20 minutes. So in the next, certainly it's been 20 years, Stephen Vasquez particularly has been sort of codifying systems for working with different types of psychological disorders and indeed physical disorders, and has had transformations of all kinds of physical illness, things like cancer that aren't supposed to transform, stage 4 cancers, for example. And he's been filmed by international television crews doing the work with colored light through the eyes. But this was a 2020, which is one of the national news programs in the United States. And it was killed by the science editor because he said there wasn't enough scientific evidence. They showed these people, these 2 women with late stage 4 breast cancer, who you saw their mammograms, you saw their blood tests. Clearly, they were headed towards death. 6 weeks later, after 5 days a week of light therapy, there's no sign of cancer in their body. So that fell on deaf ears. So I talk a lot about emotional transformation therapy, the use of light in psychotherapy, but light is a breakthrough treatment, and whether you're using it through the eyes, on the acupoints, on large segments of the body. So a breakthrough therapy requires less time. There's usually no other known effective treatments, and it really evokes depth core level changes and leads to long-term resolution or cure. I remember in psychology graduate school, we could not use the word cure. And there were the really bad diseases that the diagnostic labels, they were going to hang around forever, that there was nothing known to do. And that was my life before light therapy. And I'm sure every other health practitioner has similar stories that we'll hear this week. In 1996, I put out the book Light Years Ahead. And this is from a conference largely in 1992 when we had Jacob Lieberman come and talk to us about light in San Jose, California. And we had other pioneers like Norman Shealy, who you'll hear about in a few minutes. Stephen Vasquez was just starting to use light in psychotherapy. There were pioneers in the use of light on the body who were very famous chiropractors, and people using light in acupuncture as well. What I love about ILA is it gives me an opportunity, and gives all of us this opportunity to talk about light in a holistic way that's not possible in any other forum. If you go to medical light conferences, because of the biochemical paradigm, you can only talk about biochemistry. You can't talk about all these other dimensions of light, whether it's quantum physics, whether it's subtle energy healing. It's not welcomed. So this is the Indian parable of the 9 blind men and the elephant. And when one person goes to the tail, the blind man says, the elephant is like a piece of rope. And the one over by the ear says, oh, the elephant is like a big bed sheet. And you put it around. So each paradigm of looking at light has their own bias and their own, as Don Bernisky says, their myopic view of what light is and what light can do. And light cannot be contained, right? Again, to review what Alexander said so ably yesterday, these were the ancient solar societies from all over the world. There's Akhenaten in the top left. We have Stonehenge. We have Chichen Itza in the lower left, and Tranquilo from Peru. These were all solar observatories built by so-called primitive societies thousands of years ago. So every facet of ancient society revolved around understanding and appreciation of mankind's relationship with the sun. And this was from religion to healing to architecture and to agriculture. These are just a few of the solar civilizations who had solar deities. I can put one more in here. Jacob Lieberman comes from a place called Maui in the Hawaiian Islands. Maui was the sun god that drives the chariot across the sun every day. Well, that sounds a lot like Apollo in Greek mythology. This is from the East, looking at light from the Ayurvedic point of view or from the Vedas. Arguably one of the oldest books on the planet are the Vedas. This was an oral tradition in a place before there was countries known as India or China or Tibet. There were civilizations who were profound seers about the nature of life and man's relationship to life. So in the Sam Veda, it says the spirits down here in man and the spirit up there in the sun in reality are only one spirit, and there is no other one. Well, that sounds like quantum physics to me, the quantum field. And from an Eastern medicine point of view, the higher mind and the soul are actually considered fire element. So our inner light is helped to digest our emotions and our thoughts. You can have mental digestion, indigestion. You can have emotional indigestion. And it's the outer light and colors that helps with our digestive process. From the Bible, there's over 237 references to the concept of light. And I'm saying this not just from the Christian or Judeo-Christian standpoint. This is true in the world's religions, whether you're looking at Zoroastrianism from Persia, the religion of light, or from Tibetan Buddhism that talk about spirit as the clear light. And all these ancient societies and more had very in-depth color meditations, if you will, to help evolve the person, prepare them for the journey to the next life. So here are 2 other light therapists in our group, and I hope you have an opportunity to join them in their exploration of heliotherapy. But for me, these two women personify that important quality of light and joy and play, which is so crucial to the inner light and evolving us on a spiritual level. Once again, as Alexander says, Apollo was the father of Asclepius. For me, it's interesting that he was the god not only of light and medicine, but also music. So perhaps the ancients knew this inner connection between light and sound and healing. And Apollo's sister was Artemis Selene, the goddess of the moon. Asclepius, again, was his son. We still have today in our language his two children, Hygeia, hygiene, and Panacea. It inspired Hippocrates, and Alexander talked about Hippocrates using solar therapy 4th century BC. And Herodotus, the famous Greek historian, had written about solariums and heliotherapy, and that exposure to the sun is highly necessary in those persons whose health need restoring. Just want to look at light from a historical lens. This was fascinating to me that Plato, 380 BC, was saying it's our inner light that goes out and meets the external light. And it's the marriage of the inner light and the outer light that gives us the ability to see. Now, these ideas were shut down, obviously, later in optometry, but for me, as an energy-oriented person who studied Eastern systems of healing, this makes perfect sense to me. Don't we all experience the light in someone's eyes when it connects with us? We can be driving down the road and making eye contact with somebody and either feel great joy or contraction from the inner light. And finally, this week we'll have a lyceum. Help me with the words, Teresa. Lykios, is that how you say it? Lykios. From Of the Light, for the sanctuary to Apollo. It was here in a suburb of Athens that Plato and his student Aristotle lectured as they walked with their students in 330 BC. We'll have an incredible opportunity this week to learn from the pioneers of light and color therapy, and I really look forward to this dialogue at the end of the week as we have an opportunity to share and vision our future together as light and color therapists. Another one of Aristotle's students was Ptolemy, and he talked about visual entrainment, that basically looking at sunlight through the spokes of a spinning wheel could induce contentment. So here's the forerunner of this whole visual entrainment, the use of using flickering light and strobe light, exactly. So this was back the year 300. The biochemical paradigm is obviously, in the last 20 years, the predominant paradigm of looking at light. A lot of the medical light therapists who've done the pioneering and really necessary research in chronobiology and understanding in minute detail how light affects all the neurotransmitters and the hormones all over the body have given us a lot. And down in the lower left corner, we know so much more today about red and infrared light and how it stimulates our mitochondria production, the ability of our cells to repair themselves at an increased rate. You're actually hearing doctors saying, by the use of light, we might be able to reverse the aging process. The only difficulty for me showing up at these scientific meetings is I feel a little bit like an outsider. It's the first time I've experienced that sense of prejudice, that I wasn't welcome in that group because I wasn't part of the scientific medical research community. But their light research in America, and I imagine it's true in Europe, is funded by the pharmaceutical companies, as well as the military in the US, as well as the National Association of Space and Aeronautics, NASA. So you can imagine how limited scientific research will be in terms of funding versus drug education. This is our friend Marco Bischoff, who is our president, and I'm sure Alexander will talk about Marco Bischoff and the sort of the quantum physics, biophysics paradigm of light in his presentation after mine. So I won't say much more about that. My favorite book this year, and actually my favorite person I studied with, is a man by the name of Dr. Stephen Bartlett. And I encourage you to look at his website. It's called matrixenergetics.com. Stephen is a phenomenal healer. Not only is he trained and has 2 medical degrees in naturopathy and chiropractic, but he's a profound student of quantum physics. Matter of fact, his next book is coming out in October. I'm really looking forward to this. It's called The Quantum Physics of Miracles. So what we see with light indeed is miraculous, and perhaps we can explain it and understand it better if we look at light and healing and cell physiology and biology beyond the Newtonian physics and look at quantum physics. But the level of the photon, he says, consciously directed intention can alter the behaviors of photons. He says when we talk about photons, we're talking about light and information. We are literally, when we understand this, what the words of the Buddha, I guess, or Samasati, as Jan teaches, and the Delphi know ourselves, is we take our egos and identities to be solid, somehow fixed, like this table. But truth is, at the level of the quantum physics, we're rolling waves of infinite possibilities, and where we focus our mind is so important to our opening to our ultimate realization of who we are. So we are just patterns of light and information. And if there's time, I'll explain a little bit to you, those who are interested. I've been working with narrowband light, the ability of a new light device that can adjust in minute amounts the amount of red, green, and blue from 0 to 255, which is the CIE standard that our plasma screen computers and our televisions use. But just the minute shifts in red, green, and blue, you can feel a physical symptom of the body, like a chronically held pain, or in my case, I had severe gout that was throbbing and inflamed. The pain moved around the foot and finally discharged, leaving no pain just by shifting the amount of red and green and blue in minute levels. Using, thank you, red, green, and blue through the eyes. But I believe the same thing will happen as these instruments become available for use of light in the body. And I think that's what Carl's dome is about, and Pierre's holobiocolors, and other people who have really playing with this very small, minute, perhaps monochromatic changes of the major colors. So the subtle energy paradigm is represented here by Chinese medicine and Ayurveda, the traditional East Indian medicine. This is the traditional systems of healing that are somewhere between 6,000 to 12,000 years old that were the first systems of healing. And today, this week, we'll hear about Psy.D, color puncture, and we'll hear from Jan a little later in the week. Jacob Lieberman really introduced me to this whole biological, psychological, social, spiritual paradigm of light. So what happens in our mind is everything about our receptivity to certain colors. Jacob's clinical practice was called color receptivity training. Stephen Vasquez did something similar and different called emotional transformation therapy. And Pierre von Aubergen's whole idea of chromotherapy comes from this: what happens inside of us, our inner light, affects our receptivity to the outer light. And from this we have things like the Lucier Colors test that Doris and Alexander will be leading us in later this week. We have Pierre von Aubergen's the chromo test, or color test. And Stephen Vasquez used something called the chromosensitivity assessment, where he looked at people's visual reaction in terms of colors, what they saw in terms of colors and movement to each color, what they saw in terms of, or what they felt in their body in terms of stress, did they like it, didn't like it, what thoughts they had and what feelings. And from that, he gave people a score of their most comfortable or least comfortable colors and gave us an idea of how to proceed without creating undue stress or trauma in people. We don't need to talk too much about the second light revolution after the discovery of fire. It was actually James Swan. It isn't Thomas Edison, as most Americans are taught to think. It was a year earlier in England by James Swan. But this single invention has changed our species perhaps more than any other, because it gave us the ability to burn the candle at both ends. And did you realize before light was widespread in houses, say the 1930s, 1940s, it's documented that people slept an average of 12 hours a night. And today that figure is down to 6 hours. And as Alexander would probably tell you, that our chronobiological rhythms are way off, that we need to greatly reduce the amount of environmental light at night if we're not working the night shift. But we can go on and talk about that forever. Alexander did such a fabulous job talking about heliotherapy. But modern medicine started to have a recurrence of interest in it in about the 1920s. and looking at things like arthritis, paralysis, rickets, edema, all the deficiency diseases. This is before pharmaceutical medicine, which started to come in about 1940. In the upper left, that's Florence Nightingale during the Crimea War in 1886. And Florence Nightingale really went on a crusade to stop the spread of disease by germs on the skin. And she fostered patients using solaria, sunrooms, to be a part of every modern hospital and clinic. It was a radical idea in the 1890s. We talked about Auguste Royer. You could just see some of these beautiful hospitals. They look like Swiss resorts. I just wanted to say quickly that at the peak of Royer's career, there were more than 1,000 hospital beds in more than 14 Swiss hospitals. Royer himself was trained by the leading surgeon at that time in Europe. And he stopped the practice of surgery because he felt sunlight, and doing the sunlight cure and working with diet and exercise would have more beneficial effects. This whole thing of treating surgical tuberculosis, as it's called, more than half the patients died from infections that were received from surgery. And after he lost his best friend, who was a surgeon himself in training, through this surgery that was supposed to cure the disease, he knew there had to be a different way. So that was what stimulated him on a whole different career path. So here you can see the children are at school in the sunlight. Their only dress was basically a diaper and a hat to cover themselves. They exercised outside, they worked outside. Gradual, slow, gradual, 5-10 minutes at a time. So there was a golden era of light therapy from the 1860s to 1938 when we see the first introduction of the pharmaceutical revolution, sort of taking over medicine. But when you go back and look at the history of medicine, you can go back into any med school here to look at the archives. You can look at journal articles and medical textbooks. Every single subspecialty of medicine, including psychiatry, optometry, chiropractic, used either sunlight or artificial light sources. And there was an incredible interest in light. So all over the world, North and South America, Europe. So we'll just take a look at some of these are carbon arc lamps. These were patterned after street lamps in Copenhagen. This is sort of what gave Finsen this is in France. So all over Europe, these were used and experimented with. So here's Finsen again. Alexander covered him so well, but he was such a pioneer. We'll just see basically his clinic in Copenhagen. You can see the artificial light sources he would use in the dark months. Artificial sunlight, essentially. And here the quartz glass in the lower left that was filtered through methylene blue to take out, or to focus. Actually, he was creating a spectrum from green to just the first part of ultraviolet. So I know we quote him a lot for color therapy, but I think there is some truth to he was using light within the visible spectrum as part of that. So you can see the before and afters that Alexander put up. Dramatic. Healing without scars. These were people who were disfigured. And there was no hope, no antibiotics for this lupus vulgaris, skin tuberculosis. So this is Harvey Kellogg, who's one of my favorite people. You can get a lot of these books. I don't know if Alexander mentioned, but is it googlebooks.com? A lot of these ancient light textbooks that those of us who are history buffs have had to work so hard going around the world to find in these esoteric bookstores or photocopying from the bowels of med school libraries or something. You can get them now online. I think if the book is older than 50 or 70 years, a lot of these books appear online, so that's good. This was from a textbook Dr. Kellogg wrote, who was a physician in Michigan. His cousin made the famous Kellogg's cornflakes, but you can see someone swallowing an ultraviolet light source to handle throat and laryngeal infections. And this thing that looked like a ray gun is actually a water-cooled device in the middle. It looks like an enema bag. So there's a real fascination. And Kellogg's devices also in the 50s using the first incandescent bulbs to create heat. So this was probably using obviously heat therapy, infrared, and perhaps a bit of visible light as well. But the thing that really shocked me, that there was an awareness in the early 1900s in psychiatric hospitals where I had worked. They were using red light rooms and blue light rooms in inpatient psychiatric hospitals in Europe, the US, and Argentina. They used red light to help heal what they called chronic melancholics, to energize those who were sleepy, chronic, or catatonic depressed, where they used the blue light rooms to help those who were mania, having bipolar disorder, or what they used to call alcoholism, I love the old word, called dipsomania. Dipsomania. We get to practice some of that this week here. So I agree with Alexander's stance about ultraviolet light. Artificial ultraviolet light sources, you have to be careful, but these are just some pictures from around the world. The upper left is from the 1930s. Upper right is probably from the 70s. This is in Finland, where they don't see the sun for like 40 days each winter. This was, in the lower left, was from a school for the mentally retarded in Southern California in the 1950s. And I believe this is in Northern Europe, where the kids are actually taking a filtered ultraviolet through their mouth to prevent dental cavities. Yeah, why not? So again, more of Kellogg's stuff, using the first incandescent bulbs I guess this was probably healing rheumatism at the top, probably helping with tuberculosis in the back, and more recent medical light therapy device from the 1940s. You go see medical light therapy really disappearing to fewer and fewer specialties until those who were specialized in only physical medicine in the 1950s. And after 1960s, you see no mention of light for a lot of years. So here, Kellogg's cabinets from 1905. Burdock in the lower left. This was treating a sinus infection in the 1930s. This was surprising to me. This was a hospital in Cincinnati, Ohio. They actually had a heliotherapy ward. And this light device that looks like something out of a Frankenstein movie put out 100,000 candle power, a bright artificial sunlight. So that's like the brightness of sunlight on a good summer day. So just feast our eyes. I mean, these were kindred spirits to us, I believe. The Kromeyer lamp, which was, I believe, using portions of the ultraviolet spectrum, a water-cooled lamp. And this gave the ability to treat infections in places where the sunlight couldn't go, like the vagina, the anus, oral cavities, the urethral cavities, as well as using light on skin. I love this. This I found in an old American Medical Association journal in 1927. This is before the pharmaceutical revolution. And they knew that light was to health and happiness as darkness is to disease and despair. You wouldn't see an advertisement in today's AMA journal for anything other than pills. So the Dark Ages of light therapy, we can boo and hiss here like any bad movie. This is where you see the disappearance of medical light therapy and light research. Because you had things like the first antibiotics in the late 30s, the first tranquilizers and psychiatric medication in the late 40s, and continuing today, with huge political and economic incentives to move away from naturopathic modalities such as light towards drugs and surgery. This was funded by America's three leading, what do I want to say? What's that? Dark people? Yeah. Yeah, this was, Rockefeller, Carnegie, and Mellon. I mean, Rockefeller owned the pharmaceutical companies when he discovered that you can make patent pharmaceutical medicines out of oil. He owned the oil companies. Carnegie and Mellon owned the steel and railroad industry. And they were international tycoons. So they hired this person named Flexner, who was not a medical doctor, to basically go criticize how medicine was taught. And at the turn of the century, in the early 1900s, there was a lot of homeopathy and naturopathy. And this man and these three men single-handedly dismantled that. And because Rockefeller's donation to medical colleges in the United States was 2 to 3 times as much as the federal government. So that's what got us off this naturopathic healing, and it's been brought back by popular demand by you and I. This was somebody that Jacob turned me on to, this Edward Borsler, and I love him because he's a great example of the little man fighting the medical establishment. He invented a light device that basically tried to mimic as much as he could sunlight, used near-infrared, near-ultraviolet, and visible light. And he got a lot of good medical and dental journals to talk about the healing of wounds after dental surgery using this device. And the American Medical Association and Food and Drug Administration tried to shut him down, and he won a court case in 1952 at a time where there was still democracy and freedom in America. So you've seen 150 years of medical light therapy. So here's a journal article from the American Medical Association in 2000, fairly recent. It says the therapeutic efficacy for infrared, ultraviolet, and low-level laser therapies has not been sufficiently established to permit recommendations. So what are they recommending? Drugs and surgeries in year 2000. Although I think this pendulum is swinging back the other way. As Alexander and Larry Wallace and others will mention, there is just a flood of research of physiology on the effects of light in the body. We can't get away from it. This is just to review what Alexander so expertly did yesterday. The benefits of vitamin D3, the sunshine vitamin. So we have deficiency diseases that are greatly helped by sunlight, and benefits. And now we're looking at sunlight and things like Alzheimer's disease and improving intellectual functioning, improving the immune system functioning, improving neuromuscular functioning, as well as the things we've known from 100 years like rickets and bone disease and high blood pressure, etc. So we should tattoo this one on the back of our eyeballs because the medical establishment is, you fight research with more research. So I think tides are turning. This was the beginning of what I call a new age of light, started by Dr. Norman Rosenthal at the National Institute of Mental Health in Washington, D.C., and George Brainerd and Michael Terman doing the first research on bright light, fluorescent white light to treat winter depression, but also regular depression, major depression called unipolar depression, and manic depression. And looking at bright light to affect our circadian rhythms for sleep work and treating other diseases like bulimia. Bulimia has a seasonal component as well. It gets worse in the winter as the serotonin decreases. So you can use light in addition to drugs or in replacement of drugs. This is somebody that Jacob talked about, John Ott, who was not a scientist, and the scientists are quick to tell you he's not a scientist. But this man is a pioneer and a hero. He was a Scottish banker who had a hobby doing time-lapse photography. And if any of you have seen some of the Disney films like Fantasia or On a Clear Day You Can See Forever, where you see a plant going from a seed to a shoot to a full flower in 30 seconds, this man painstakingly took these time-lapse photographs. And John gave us the concept that our indoor lighting was grossly inadequate for our biological and psychological needs. And the slide in the lower left is showing us that plants grown in full spectrum light, a light that can mimic sunlight, had the healthiest appearance. And while plants grown in the dark would obviously die, and those with predominant of yellow, red, or blue spectrum would not do as well. So we needed the entire spectrum of light. But I think, as Alexander has so expertly said, fluorescent lighting is not the way to go because of its mercury toxic effects and a whole body, whole vision effects. But John started a whole revolution in lighting in around the world. Norm Rosenthal, winter blues, the first person to coin the term winter depression, seasonal affective disorder from a lack of light. You have to realize in the late 1970s, humans were thought to be so superior to other animals that our brain and nervous system was supposed to not need outdoor light. That somehow our brains were more adapted than every other animal in nature, and forgetting that we need light as much as every single organism on the planet. So Norm's full spectrum bright light box used 5 to 10,000 lux of light. That's the brightness of light during a sunrise, for somewhere from 15 to 45 minutes to change the neurotransmitters norepinephrine and serotonin. Light is a natural Prozac. It's a natural antidepressant. And I agree with Alexander is that too much bright light creates stress hormones and does a whole bunch of bad things. But I think there's obviously balance and new lighting sources that Alexander will lead us into here in his talks. George Brainerd, who has come to many syntonics meetings, who's a professor at Thomas Jefferson Medical College in Philadelphia, Pennsylvania. He's arguably the world's leading expert on the pineal gland, and his research has led to the development of the light visor that Jennifer's wearing there in the lower left. And his lighting has his research in lighting has contributed to lighting the International Space Station and the space program. You have to understand that astronauts are exposed to 18 sunrises and sunsets a day. And before, there was in their sleeping quarters, there was no dark out, so they were getting the sun coming up every 90 minutes. That was royally screwing up their health. So, Michael Terman is another excellent light researcher. He's at Columbia University in New York City. I really recommend this website. It's called www.cet.org. There's a generous amount of information on light that has been, my complaint with a lot of the medical light researchers is they've needed to dumb it down take the esoteric aspects of medical light research and make it simple for, like Alexander is doing for us, mere mortals here, so we can understand it and use it in our life. And I think there's a way that medical light researchers, particularly in the past, have had a small, closed club, and they wanted to keep their research to themselves, and light belongs to everybody. So these are the bright light boxes, supposed to be white light boxes that cure winter depression. But as you can see, the one on the left is high in the orange, the one in the middle is green, and the one on the left is very high in blue and ultraviolet A. So they all say that white light affects, but there's in the medical light paradigm, do people's psyche, do our beliefs, our traumas have anything to do with our color and light receptivity? And just another warning why I don't feel comfortable in those groups, I have to go and keep my mouth shut when I go to the meetings, is there's something called the Medical Skeptics Journal, and there's something called Quack Busters. Quack is from an old, there was quicksilver, mercury was used as early medicine, and the quacks were the medical doctors who were poisoning people. So now that term has devolved into, if you're practicing something that isn't traditional drug and surgery medicine, you're called a quack. So there's a website now that has put color puncture, the use of colored light on acupoints, as a list of quack things. And there's actually a quack museum of medical devices, and sadly they have Dinshaw's light device there, which is big disservice. This is Norm Shealy, who came and talked to our first Light Years Ahead conference. And he did us a big favor. This is the first time in the United States that using John Downing's Photron machine, using just colored glass filters of red, green, and violet, he measured saliva levels of hormones and neurotransmitters. And he was able to show a 300 to 600% increase in just 30 minutes of looking at red, green, and blue light, strobed at 7.8 hertz. You'd probably have this with a solid light, non-flashing, but Norm was great. And Norm founded the American Holistic Medical Association. He's a neurosurgeon. He's very outspoken proponent of alternative medicine. This is somebody this year, just Dr. Gordon Dougal. And now they're using, I think it's 10 minutes a day of 1072 nanometers using a light helmet. It looks like something that's a diving bell or a space helmet. But they're starting to show some good experimental research in the preliminary stages. So over a month, they might reverse some of the cognitive symptoms of Alzheimer's disease, such as memory loss and anxiety as someone is losing their ability to think. So it's thought that the helmet will not only slow down the rate of decay, but it can even partially reverse it. That's miraculous. Low-level infrared can harmlessly pass through the skull, as Alexander said. Our skull is transparent. When you take a skull and put it up to sunlight, you see it. So infrared passes through the skull, and it seems to pinpoint the plaques and tangles that tie up the neurons that are the signs of Alzheimer's disease. Alzheimer's disease is basically shorts of neurological transmission. So infrared is thought to stimulate the growth of cells of all types of tissues and encourage their repair. This Dr. Gordon Dougal, another hero, same guy, has a 1072 nanometer device that's used for cold sores. So this is a very special frequency, it's immune boosting. And this device was approved by the British National Health Society. So here you have National Health Insurance picking up a light device. Wow. Another one of a man I owe a lot to for my personal health is Dietrich Klinghardt. He's a Swiss medical doctor who's taught many people in this room. But Dietrich uses light to broadcast through the eyes to broadcast homeopathic remedies. He also uses light or things like mercury or MMR, like the measles, mumps, rubella shots that kids have been exposed to that are particularly toxic. Well, he uses light through the eyes to draw those toxins out of the body. And he can show through blood tests that you're actually detoxing, increasing the rate of mercury detox using light through the eyes. And Leona Vermeer, who's one of our previous members, who's talked to us about her device that she uses, the Rainbow Flash. Still a member, I believe. Yeah, thank you. This was very exciting to me. MRSA is a staph-resistant virus that's spreading through hospitals. It's skin-eating, I believe. So here's a low-cost treatment of just 100 seconds of blue, visible blue, I think it's narrowband light. So here the drug companies have nothing to offer for this very serious infection. So here we're relying on light to treat something that previously didn't respond. And the same company is using 415 nanometer blue and 660 nanometer red to treat acne. So these are recent 2009 photomedicine and laser therapy. And this is our wonderful president, Alexander Wunsch, who you guys know, needs no other introducing other than we'll hear more from him. And Doris, yeah. So he's a light university in himself. One of the things that I'm most grateful for, Alexander, is this insanity on banning the incandescent light bulb and why incandescent makes sense for our health and why mercury is so toxic to the eye and the whole body. So perhaps we can get Alex to talk about that a little later. Alexander, sorry. We'll look at the pioneers for colored light just briefly. And these are the old pioneers going back from the 1870s through people here in this room. We're all pioneers in the use of colored light. Anna D. Martel, Jan and Wilma, Nishant Matthews, Carl Rieberg, Pierre von Obergen, who is in here, all of us, Larry Wallace, Don Bernisky, and of course Jacob. So the mid-1800s, modern scientific medicine, or allopathic medicine, began to replace, as I said, naturopathy and homeopathy. So there was an interest in the healing power of light that began to appear. This was a book by Seth Pancoast, and another book a year later by Edwin Babbitt that formed the basis for a lot of what we do with light from the blue end and light from the red end of the spectrum. This was a greenhouse that alternated blue and white glass, and Augustus Pleasanton was talking about how he could triple the reproductive or the yielding capacity of grapes grown in this solarium, and he was experimenting with animals, and he felt that humans needed blue light, and that needed to be explored. 1876. Next year, Dr. Seth Pancoast wrote Blue and Red Light, or Light and Its Rays, as medicine. Pancoast again used sunlight filtered through panes of red glass to accelerate or stimulate the autonomic nervous system and to create balance in the body. He took a rather hostile and anti-scientific and more metaphysical, spiritualistic stance regarding light, and quoted liberally from ancient mystical texts such as the Kabbalah and the Bible. My type of guy. Edwin Babbitt. I love reading Babbitt because he reads like a fabulous naturopathic doctor. And I think Babbitt's ideas influenced those in optometry, syntonic optometry particularly. He was a physician, a physicist, and a priest, and he really talked about individualizing colored treatment to the person's constitution and their age and their debility. This was breakthrough ideas in 1878. So he invented the chromodisc, and the chromodisc uses colored light through this cone-shaped device. So that was one device. He had the chromo lens, which you could take sunlight charged or water charged through different colors of vials. This was his favorite healing method. He had the chromolume. He had cabinets with sunlight or artificial light, and there's actual descriptions for the size and the cut for each of these colors of glass. And this is a former ILA presenter, Chris Terrell, who's a art education professor in Texas. And Chris is a gourmet artist, so this glass was made from the time that Babbitt was doing. So this is a 150-year-old glass that she made her chromolume out of. She sells these commercially. Dinshaw Gadiali, I'm not going to say much because Alexander will go in depth, but we owe so much to the future of light through Dinshaw's. His book reads like a pharmaceutical or herbal manual, the actions of 12 colors, and Alexander will go into depth. He wasn't a favorite with the medical establishment. No diagnosis, no drugs, no manipulations, no surgery. And when in doubt, use green. So, and what I see when I look at his body chart, and he was talking about use this color on this body segment for this amount of time, these are marma points. These are acupoints that have been around in Asia for 6,000 years. So he was an Indian, he was a Persian man from India, but when he came to the US, he used very scientific Western medical terms. He was a mathematical and scientific genius, but he steered it away from Ayurvedic medicine. But those of us who study it say, oh, I understand. So Kate Baldwin was a medical doctor, was a surgeon who really stood up for Dinshaw when the FDA tried to destroy him. And she said she could do quicker and better work with light than with any other method that she ever used. This is Grace Sherlow, who was burned, 2nd and 3rd degree burns all over her body. And at that time, she was in pain and dehydrated, and there was little medical doctors could do for her except painkillers, and she faced, no doubt, certain death. So he treated her with her light, and here's the after pictures in the lower part. This might be interesting to Alex and Doris. This is American chiropractor Dr. Bertrand Desjarnais. And cranial sacral therapy today, part of the forerunners was this Bertrand Desjarnais, his technique is called sacral occipital technique. In 1941, during World War II, he wrote a book called Chromotherapy, where he outlines 375 conditions and neuroendocrine balancing that can be done with colored light on the body. Those books are available. So the optometrists really are responsible in my country for really saving colored light therapy and evolving it. And let's just say Larry Wallace and Jacob and Don, all of us have benefited. Harry Riley Spittler wrote the book Syntonic Principles. Spittler was researching light on humans and animals in the 1920s using other early colored light devices, most originally without strobe, later some flash in there. And this is our wonderful group of people are here. Larry, Don, yeah, please. So we'll hear more this week about the use of light to improve learning and performance, making dramatic breakthroughs. But all this comes from light and optometry, syntonics. Jacob, we owe so much to. My favorite book on light ever is Light Medicine of the Future. And take off your glasses and see. I don't know if you realize that these are the two most popular books on light and vision ever written. I think they're in something like 12 different languages. So Jacob has done, I think, more to spread the word about light than anybody I know. And his device called the Spectral Receptivity Trainer. Wonderful, wonderful device. We still have it. Use it in groups. That's what he would do in these groups of 300 people. Use this very small yet very powerful device that went through the entire color spectrum. And he'll talk to us about the eye port, exercise your eyes. And finally, his book, Wisdom from an Empty Mind, is mind-blowing, written like a Buddhist master about realizations he's had working with people in light, in the inner light, and co-written by his son Eric. John Downing taught me about light in the late 1980s. His device called the Lumitron, and the miracles that happened when visual fields were open. Before therapy, the visual fields was collapsed. After therapy, the visual field would open several 100%. And neurologically, emotionally, big changes. We're jumping to a new topic. This is environmental light, and here we have our wonderful friends and geniuses, Ana Di Martel and Ma Premo. The Sensora, I hope we get an experience of it here. We will, later in the week. Anna D is a audiovisual electronics genius and a physicist, and Ma Premo is a psychologist. And we're just really grateful that they put this light, sound, and kinesthetic device together. And in the Light Hospital, I definitely like to see this there. Alexander was saying things that need to be, I'd like to see one of these in every airport and every healing center in the world. Sensora. Carl Albert Fischer from the Austrian Institute for Light and Color will be teaching us later in the week about our old pictures of color and light, our archetypes, psychology, and design of color in the 20th and 21st century. And I pray that we can put together a wonderful conference in Vienna next year with Albert's help, or Carl's help, rather. So we're turning now to use of light on the acupoints, use microsystems of light. So light acupuncture, if you will. Really pioneered by Peter Mandel from Bruchsal, Germany. This is Peter's American student, Monohar Krook, who's taught his methods for 15 years in the United States. I don't know if there are newer books available, but these were classics and really helped me understand color puncture and esogetics, from Mandel's idea of energetic and esoteric, so his discipline is esogetics. And when you go to Peter's clinic in Bruchsal, he's Curlian photography of your hands and feet, sort of before and after light treatments. And when Jennifer and I were diagnosed with Curlian photographs, he proceeded to tell us everything in our life physically that was wrong, but also the significant emotional traumas that we had starting in infancy, based on the emissions from our hands and feet. And Peter Mandel's son Marcus came and talked at our first Heidelberg conference, and there's their websites. Psy.D is the product of Nishant Matthews, an American psychologist living in Amsterdam. And Nishant's genius was taking consciousness and taking personal interaction with color, versus color puncture is something that was done to you by a doctor, sort of hierarchical. Nishant wanted to explore, much like Jacob, people's interaction with light, their emotional reaction, really working with presence and contact in the body emotionally. Nishant was the teacher of Jan and Wilma. And Jennifer and I had the privilege of attending 11 days of instruction with Jan and Wilma. And my slide's loading here. I just have to say they're master teachers. They're teachers of teachers. And we just had a great time. The learning materials are the best, most sequenced books I've ever seen written about light and applying it on the body. Most concise books. And we went over 50 different specialized color light treatments on the body. And we had ample opportunities to practice on it ourselves and on other people and receive major healings. Anna D was there as well. And Jan and Wilma student Lynn Duell will be talking to us later in the week. And Lynn and her partner Simon Hansen treated a little boy named Mason. And Mason was born with necrotic fingertips. His fingertips were deep blue. And the pediatric surgeons and the pediatricians were saying that the baby's fingers had to be amputated to save the rest of his fingers. And Lynn and Simon decided to give color light a chance to treat the baby's fingertips. And here you can see the happy story. The fingertips grew back with colored light treatments. And we'll hear about that with Jan and Wilma. This is the light device they use in Psy.D called the Lumilight, which comes from Toronto, Julianne Bion. She has wonderful color set of CDs, DVDs, and color therapy on the body with instructions. She's come and talked at Syntonics. This is our member Pierre van Obergen, who has the School for Integrative Color Therapy in Geneva. And Pierre is a genius, right and left hemisphere genius, acupuncturist, artist, sculptor, color theorist, designer. And we've enjoyed studying with Pierre in the United States as well as when Rondine Marie brought him to Oslo. His device is called the Holo Biocolors, and it was developed with French physician Dominique Bourdon. and he's the author of the Color Tarot, and we'll show you one of his Color Tarot. This is called the Color Oracle, and it's just coming out in France. Pierre's gotten a lot of notoriety. He's become a rock star recently. He sends his love to everybody. I'm going to go back one. He sends his love to everybody. He's teaching 8-day courses. He's giving people experiential courses of the opposite colors, like magenta and green, a whole day. Can I have 5 minutes? I started late.
Yes, we lost our coffee break. Excuse me, that's a good point because we need to get here on time in the morning.
Yeah.
We lost our coffee break.
I'm happy to stop. There's just some people I'd like to acknowledge who are speakers, and I feel that's part of my obligation. But I'm happy to stop anytime.
Well, it is fast.
Okay. It's just I was late getting hooked up. Okay. Chromo tests, his cards. Where am I going to go? I want to acknowledge, our women who are talking about light and education. Greta and will talk on light and dyslexia. Teresa will talk about the use of light and color with teaching the personality, the 9 enneagrams of personality. Elizabeth will talk about using light in language education, and Denise will talk about using light and color with the visual field and iridology. I want to acknowledge one of our members is doing miraculous work, Pauline Allen, who couldn't be here from England, the Sound Learning Center. She's doing colored light through the eyes and Tamata sound work. And she recently had a miracle with a 25-year-old Romanian orphan. Many of you know about the orphanages in Romania where the children were not tended to, so they're severely autistic, they never develop language, they have severe attachment disorders. She and her husband Phil gave their time to this orphanage, and after 2 weeks of working with this 25-year-old, at a time when neurologically there's not supposed to be any changes, she got this 25-year-old to be able to pronounce and hear their first words. That's a healing miracle with light. I won't talk about light and psychotherapy, just in the interest of time. And where are we going from here? Maybe just 2 brief things on what I see as the future of light. We need an integral curriculum. Talked about university level education. We are all getting older, and we need to pass the baton to younger members of our society. That's why we need online or regular university education in light, and certainly there's enough expertise to make that happen. And thanks to people in this room, we have a widening association with people like PLDC, professional lighting designers, the World Association of Laser Therapy, CIE, but we need to spread the light to places in Asia, the Middle East, South America. And we need lower costs and simpler light and color applications. I've become a fan of using colored cloth and colored posters working just as a low cost option. And finally, our paradigms of what light can do are changing with quantum biology and the idea of neuroplasticity, that we have the ability through our attention to actually change the structure of brain cells as well as the physiology of brain cells. And light is key in neuroplasticity. And Stephen Vasquez and others are using colored light in the eyes. They're actually getting SPECT scans of people's brain, actually measuring blood flow in the brain, taking people who are neurologically injured 2 years afterwards, and after a 4-hour session of light therapy through the eyes, the brain, in terms of blood flow, looks normal. So, and other ways that we can get out of the medical model using light to coach for optimum performance, using light to evoke transcendent states and bliss, and finally helping people meet their end. So thank you for listening, and